We're celebrating our 25th anniversary here in the Marina. Back in 1986, we started with just 1 or 2 employees. We're trying to deliver comprehensive cosmetic care, not just surgeries, but also cosmetic medicine, non-surgical rejuvenation. And we have our patients, they become our friends and our extended family, and they come to us on a monthly basis or a quarterly basis. They may have 2 or 3 surgeries over the course of 25 years. You know, I think men are becoming more aware that they wear their resume on their face. They're becoming more aware that it's a competitive environment out there. Up to 20% of my patients are men. We have guys that come in to have their eyelids done. They have their faces lifted. They have liposuction around their tummies or their chest or the love handles. And they come in for a lot of non-surgical services. They come in for Zeltique cool sculpting. These aren't just actors. We certainly have plenty of actors, but we have lawyers and judges and doctors and teachers and business people and people from every walk of life you can imagine. The economics of non-surgical cosmetic medicine are compelling. When we do non-surgical facial rejuvenation or body sculpting, it eliminates the cost of the operating room, it eliminates the cost of the anesthesiologist, and most importantly, eliminates most of the cost with recovery. Most of these procedures are done and the patients go to work in a day or 2 because they're much more affordable and there's less time away from work and less risk. Many people are saying, hey, that's for me. They want to look as good as they feel, and now they don't have to go to sleep, and now they don't have to have an incision, and now they don't have to have scarring, and they don't have to have healing or the risk of bleeding or an infection and so forth. So the 2 things are coming together in that there's an increasing demand to look as good as you feel, to look as good as you possibly can. And there's also an increased number of procedures where one can do it non-surgically. Surgery is surgery. There's no such thing as minor surgery. There's minor surgeons. And whenever we can do a non-surgical improvement and avoid the surgery, I like to do that. Most of our surgeries are outpatient. The patients go home and sleep in their own bed. The ones which are not, they don't stay in the hospital. They go to the aftercare facility. Patients are very happy. They're very satisfied. They send their friends. They send their family. And lately, patients have been sending me their children. I have patients that I've grown up with, and they now have children, and they're sending me their children, which is a blessing and a compliment and a humbling, wonderful thing.